Hello everyone. My name is Nishat Ikram, and I will be doing my presentation on health promotion intervention for women in South Sudan. South Sudan ranks very low in socioeconomics compared to other countries, and most of the people there live in poverty. They do not have access to clean water, proper sanitation, and proper health care. They lack in education and nutritional resources. The goal of this nutritional health promotion program is to provide education and resources such as clean water and nutritious foods to the women in South Sudan who could be at high risk of getting hypertension. The women's diet quality, food choices, their resources, and access to health care and are prevalent in their country. The Community Health Environment Scan Survey tool will be used to find the accessibility and availability of resources such as healthy food and clean water. Diet and engagement in physical activity are important to stay healthy. The U.S. Dietary Guidelines recommends for high consumptions of vegetables and fruits because they lower the systolic and diastolic blood pressure. Malnutrition is high in this country, and many people have deficiencies in micronutrients such as iodine, iron, and vitamin A. So when women have these deficiencies of these micronutrients, they are basically they get weaker, and also if they are pregnant, they do not have enough of the micronutrients to feed their fetus. So it affects both the mother and the fetus. Community health workers should routinely measure women's blood pressure and counsel women who have hypertension. So having women being counseled is very effective for them to learn about what hypertension is or what diabetes too is, and this will help them to learn what kind of foods they should avoid and what kind of micronutrients would be helpful to them. There are no qualified teachers who can help women in South Sudan. So South Sudan, the women there are illiterate, so they cannot read or write. A nutritional health promotion strategy to help reduce the hypertension disease among this population is to create a donation site where funds can be collected to help schools be implemented in the country, have access to clean water, and have farmers markets. They should have access to healthy foods and clean environments. They need resources to help them decrease the risk of getting hypertension. So a nutritional health program will help to reduce hypertension among the population. There are limitations on access to food and water. The woman must rely on limited food choices that are low in micronutrients and protein, such as cassava, sorghum, and millet, because they cannot afford foods that are nutrient dense, such as fresh produce, dairy, and meat. There are barriers for the South Sudanese women, which are the need for having humanitarian assistance, having the need for because of shortage of foods, and because they have no access for medical treatment and clean water. So they need all of those. To promote nutritional health and disease prevention for the South Sudanese women, they should be educated on factors that can lead to diabetes 2 and hypertension, such as obesity or being overweight, not being physically active, and having an unhealthy diet. There are other ways to also send the messages about nutrition and having a healthy diet. So these are storytelling. So storytelling can give messages about preventing diseases and nutrition. The woman should limit intake of unhealthy and saturated fats. Hypertension can also have negative effects on the mother and the fetus, so as mentioned earlier. There are many planning steps to promote nutritional health and prevent diseases that show culturally appropriate, affordable, and healthy dietary patterns. The non-profit agencies should work together with NGOs and other local organizations to help provide healthy foods and education about nutrition to the female residents. These organizations can also provide funds for interventions. Groups would help women who are dealing with challenges can provide emotional support for each other. So groups, also being like collectivism, can help groups of women can help each other, not only for emotional support, but also they can learn about different food recipes, and they can share those and learn more about their health. So definitely having group of women is definitely very helpful. So there are 3 levels of prevention. The primary prevention is to advocate for food safety, clean water, and proper hygiene that will help women and children. The secondary prevention is to screen and monitor the woman's health to check if there are any health conditions in the woman, such as anemia or hypertension. So anemia is so many women have anemia in South Sudan. It's a lot among them. So that's definitely something that we need to get a reduction of. The tertiary prevention is to provide therapeutic care for individuals with severe malnutrition and give rehabilitation and nutrition counseling for individuals with malnutrition or any other health conditions. It is important that outcomes of improved healthy dietary intake, lower rates of malnutrition, and lower incidences of nutrition-related diseases are measured and their progress are routinely tracked. It's very important that the women health are monitored because they are already they already have health conditions, which many have hypertension, and so it's definitely important to address that issue and look at their progress so that they are hopefully getting better. In this study, the South Sudanese women would be observed on their foods they consume on a regular basis. Women should be able to access healthcare services, which also include prenatal and postnatal care, so that they can detect any malnutrition or diseases early. Collaborations with women leaders are also great influencers on healthy dietary initiatives. So it's definitely great that there are women leaders for the South Sudanese women, because the South Sudanese women can look up to them, and they can see that they do have futures, and their future is bright. They can have a brighter future. So definitely women leaders are definitely very helpful for the South Sudanese women. Sociocultural barriers to education should be addressed and trauma-informed care and support should be implemented. So now, looking at the Campinas-Bacart's model of cultural competence, which is a model. This model shows cultural knowledge, cultural encounters, cultural desire, cultural skill, and cultural awareness. So it's basically an umbrella of all the cultural factors that there are. This model helps to find factors in the participants who are doing the longitudinal study on how culture influences their dietary habits and their daily lives. The conduct of the study should be developed that include cultural sensitive assessments. When the women are given foods that are new to them that are helpful to reduce their hypertension levels, they may not feel comfortable with integrating new foods. So when they are not feeling comfortable getting, ideas or advice on having those new foods, it's important that, there should be trust. So the trust should be built, and then they would be more inclined to have those nutritious foods, healthy foods in their diets. To make the environment better for the community and lessen food insecurity, community gardens or partnerships with local food suppliers should take place. They may feel like it's a challenge to eat new foods, therefore it is important for the intervention to be culturally sensitive. Food insecurity is important in their community, which can lead to environmental challenges. So that is it for the health promotion program, and it's about, again, the South Sudanese woman. So thank you.